My name's Mandy Ramsey. I'm the Head of Clinical and Care Governance and the professional lead for nurses that work within the organisation. Turning Point Scotland is a registered charity that provides a range of social care services across the whole of Scotland. We work with individuals who have learning disabilities, people who are homeless, people who have alcohol or other drug issues, people who have justice issues, among other things. We have 4 residential services that specifically the nurses operate out of, and those 4 services are 2 justice-based services, one for males, one for females, an alcohol and drug crisis service, which is 24/7 access, and a stabilisation service for alcohol and other drugs as well. I'm proud to say that Turning Point Scotland, in 2 of our residential services, stabilisation and the crisis service, are registered with Health Improvement Scotland as well as the Care Inspectorate, and we are one of the first social care organisations to have that registration with both in Scotland.
I am a senior nurse with TPS.
My job role at Turning Point Scotland is a staff nurse at the Glasgow Drug and Alcohol Crisis Service.
And I have been with the TPS for 13 years.
My first post was at TPS and I enjoyed it so much I decided to stay.
I work in the stabilisation service for Turning Point Scotland and I'm the nurse manager.
My role as a staff nurse there involves the day-to-day care of the residents there, as well as some outreach work, and we do needle exchange, and there's availability for drop-in for needle exchange.
I'm a mental health nurse, so my role is primarily to take responsibility for mental health assessment, day-to-day mental health care, liaising with other organisations, external organisations.
I'm here to support all the nurses, make sure everything's clinically effective, ensuring that we get the optimum health for all the service users that we work with. I also support all the nurses to make sure the continuous professional development.
I've worked at both the crisis service and I now work at the 218 service, so that's crisis intervention and criminal justice, both working primarily with people who are using illicit substances.
My background's always been general nursing, mostly cardiac type nursing. I've always wanted to work with the difficult to reach group with a really diverse range of needs and very particular problems.
It's an absolutely dynamic place to work, and because sometimes you're a nurse on yourself, you have to make really quick decisions and you have to depend on your clinical judgment. I mean, we have support by the VMO, the pharmacists, but at the end of the day you're making really quick clinical judgments. And never 2 days the same, I can honestly say. It is such an exciting place to work.
I had a special interest in self-harm and I was involved in designing the self-harm policy for the national level for the organisation, which probably not many first entry-level Band 5 nurses would get the opportunity to do that.
I think there may be a myth that social care nurses are just here to dispense medication. It's so much more than that. That's a tiny part of the role.
Something that I really enjoy about this role is the rapport that you get, especially when we're doing outreach and stuff in the town. When you're seeing people regularly, you can establish this rapport with them, and it's a really nice thing, and that's something that I'm quite proud of.
The most surprising thing about working in social care is how differently people tend to respond to nursing staff, but also the support staff. There seems to be a much more collaborative style of working with people who would otherwise be thought of as unable or unwilling to engage in that kind of work. You tend to find that people that you've been warned are very aggressive, agitated, violent. Actually, the way that we work in social care means that we never see any of that.
I worked for 13 years in the crisis service, and I think my proudest was when people knew they could come in and tell me somebody was overdosing, and I would go and resuscitate in naloxone, and I've saved quite a few lives, and that is really rewarding.
My development has been such that I've been involved kind of at all scales of working in the organisation, which again, I suppose is quite rare.
Turning Point have put me through university again to allow me to become a senior member of nursing staff. So there's loads and loads of continuous education and development. So I think that's really good. There's a pathway and you can achieve up to band 7, band 8. So it's definitely a good pathway and it's a great career.
If anyone was thinking about applying to Turning Point Scotland, I would say do it. I've learned loads. It's an experience that moving forward in my career, however that may be, I won't forget it and I'll take so much with me.
Apply. Apply. Ask to come in and do a shift. Ask to come in and do a shadow shift. I would welcome anybody to come in and just see what it's like, because I think once you're in the social care, nursing and social care partnership, it's such a lovely, it's like a family, and I think you would really, really enjoy it, and I think you'd be surprised the breadth of skills that we use in here.
If you're a registered nurse, either mental health or adult nurse, and are interested in coming to work for Turning Point Scotland, please go to our website, click on Work for Us to see the opportunities that are available at the moment, and if you have any other queries, then please don't hesitate to get in touch.